I'm Mabel Jong. You're watching continuing coverage of World Healthcare Congress 2017. And in our studio right now is Cindy Helmick, who is Chief Nursing Officer, Desert Medical Center and Cardin Children's Medical Center, Banner Health. Great to see you, Cindy.
Nice to see you.
Well, there is certainly a lot of interesting discussions about the role of the nursing staff when it comes to the different scenarios of care that we're addressing right now. What are the takeaways you're leaving with the panels that you're participating in?
You know, as we always looked at new grads differently over the years and how nurses entered the profession, there is just more opportunities as we continue to look at that continuum of care. And as we look at managing health, not just in an acute care setting, we have to be open within our education for new grads and also how we onboard them in these different scenarios as they enter the profession in the work field.
Is there a shortage of nurses?
I think there will always be a shortage of nurses. And reason is there's so many settings they can practice in, and as they evolve through their career and can do different things, we always have to be on top of what that looks like for us in the profession and how we continue to get high quality professionals out there. But most of all, we just have to make sure we have everybody in the right setting and we prepare them for that setting.
Okay, so how is acute settings, how are they attractive to new grads versus other scenarios and other kinds of clinics and care centers that are becoming available?
You know, it's about what's important to the individual professional. What attracts them to a certain scenario is really individual. No matter what setting that is, and particularly acute care, how we onboard, how we continually educate, how we support their practice, and how they can be the best they can be within that practice is really the main focus, no matter what the setting is, but particularly in the acute care setting.
And where are the nurses in this discussion today? A lot of changes with healthcare delivery in the United States now. Are nurses able to have a voice at the table, a strong enough voice to push some of the agendas that you feel are important?
Oh, by all means. You know, whether it's a nurse that's been in the profession for a long time or newly entering it, there are so many avenues to be involved. Certainly organizations such as ours really wants everyone involved in how we reinvent and how we create the future of healthcare.
The triple aim. This is something that we all have heard about a lot over the years as organizations try to reinvent themselves and aim for that on the top of their agenda. How is it in the nursing profession?
What's so great about the triple aim? It really keeps our focus. Particularly in all healthcare, particularly in nursing, it really is our focus. We have to be efficient. We want high quality care, and we need to do it in the means that is focused on our customer.
Okay. You've been to this meeting before, Cindy?
I have not.
And how are you finding so far then, the first time?
It's fabulous. The topics are robust. The individual networking has been fabulous. It's great.
Great. Well, we hope to see you back. Thank you, Cindy.
Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned.